Colorectal cancer includes cancer of the colon, rectum, and appendix. Studies have demonstrated that colorectal cancer is associated with occupational exposure to asbestos, although there are many other factors which can contribute to development of this potentially deadly disease. Although colorectal cancer is a curable disease if detected in its early stages, approximately 655,000 people die each year from colorectal cancer, and it is the second most lethal cancer in the Western world after lung cancer. Colorectal cancers are most commonly diagnosed following a colonoscopy, a visual examination of the rectum and colon generally performed with a tiny video camera. These cancers generally develop from polyps, which form in the colon. Most of these polyps prove to be benign, but a small portion of the polyps may develop into cancer over a period of years or even decades. Colorectal cancer patients are often good candidates for surgery, radiation, and chemotherapy. As with many cancers, the initial symptoms of colorectal cancer are often vague. Early symptoms can include fatigue, weight loss, gastrointestinal bleeding, and anemia. In the early stages of colorectal cancer, patients do not generally have problems with bowel function or notice bowel problems. Once the tumor grows, however, or if the cancer has formed in or within or close proximity to the rectum, bowel symptoms such as constipation, diarrhea, bloody stools, and bowel obstruction can occur. As the cancer develops, additional symptoms are often experienced by colorectal cancer patients. These symptoms include feeling that there is more stool in the colon following defecation, a reduction in the diameters of stools which are produced, bloody stools, rectal bleeding, mucus in the stool, and bowel obstructions. Cancer that is spread to the liver can result in liver enlargement, abdominal pain, and jaundice. There are a number of risk factors for colorectal cancer. Colorectal cancer is the third most common form of cancer worldwide, and it is thought to be associated with a fairly wide range of exposures and conditions, including asbestos. Age is a major risk factor for colorectal cancer, and few cases develop in patients under the age of 50. Colon polyps, which can be readily detected by a colonoscopy, are another major factor, as these polyps are thought to be the structures which develop into cancerous tumors. Fortunately, they can be removed surgically, and it is thought to reduce the subsequent cancer risk considerably. Development of other forms of cancer is associated with colorectal cancers, particularly in women who have had ovarian, uterine, or breast cancer, and in those patients who have had previous diagnosis and successful treatment of colon cancer. Dietary factors, especially diets high in red meat and low in fruits and vegetables, are associated with increased colorectal cancer risk. However, the exact nature of the relationship between diet and colorectal cancer remains a subject of active investigation. It is thought that a deficit of the mineral element selenium may contribute to colorectal cancer. Asbestos exposure has been shown in clinical studies to have a strong connection to colorectal cancer, particularly in patients who also smoked. Asbestos exposure in colorectal cancer patients is generally an occupational exposure in individuals who worked in asbestos-using industries, such as boiler making and shipbuilding, as well as those who work directly with asbestos in asbestos mining communities or in construction. Colorectal cancer develops very slowly, taking years or even decades to fully manifest itself. Accordingly, early detection of the cancer can have a major impact on the ability of treatment to remedy the cancer entirely. There are a number of methods for early detection of colorectal cancer. Digital rectal examination consists of a physician inserting a finger into the rectum to attempt to find unusual lumps or formations. This is a relatively crude test, but is useful to initially screen for obvious cancers. A fecal occult blood test is a chemical test to detect occulted blood in the stool. Endoscopy is the use of a lighted probe in the rectum and the colon to visually search for polyps or other abnormalities. Sigmoidoscopy is an endoscopic examination of the rectum and lower colon. while colonoscopy examines the entire colon. Colonoscopy is often recommended because it is easy for the physician to remove any polyps detected without having to schedule a surgery. There are other medical procedures which can detect colorectal cancer, such as a barium enema, CAT scans, blood testing, PET scans, and DNA tests of fecal matter. However, colonoscopy or fecal blood test and sigmoidoscopy are the most common diagnostic tools used in the U.S. Treatment of colorectal cancer depends largely on the development of the tumor and how far it had advanced. Colorectal cancers caught in early stages are generally considered to be curable. However, in later stages, when the tumor has metastasized through the body, treatment is much more difficult. Most colorectal cancer deaths occur in patients who were not diagnosed until late in the disease's progression. The primary treatment option for colorectal cancer is surgery, with chemotherapy or radiation therapy used as additional treatments in some cases. In cases where the tumor is still localized to the colon, rectum, or appendix, surgical treatment is intended to completely cure the disease by removing all the diseased tissue. More advanced cases can still be cured surgically by removing the entire affected section of the colon. In this case, it is necessary for surgeons to surgically reconstruct the colon to join the severed portions or to create an artificial replacement. In specifically rectal cancers, curative surgery for the cancer involves totally removing the rectum. In more advanced cases, surgery is used in a palliative fashion to slow the progress of the disease and to reduce the strain that the widespread cancer places on the body, increasing the expected lifespan of the patient. Chemotherapy for colorectal cancer is generally used before or after surgery to shrink tumors and make them more amenable to surgical removal, or to prevent additional tumors from forming after the main tumor mass has been removed. In cases where surgical removal is not practical, chemotherapy is used as a palliative treatment to slow the progress of the cancer and improve quality of life and expected survival time for the patient. In colon cancer, radiation therapy is rarely used because it is difficult to specifically target radiation to the affected area of the colon. In rectal cancer, radiation therapy is used in patients with unresectable cancer or is offered to patients prior to or after their surgery to improve control of their cancer. Chemotherapy is often given concurrently with radiation. Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net. Information and help for patients and families.